For today, I will be discussing an overview on COVID-19, discuss the facts and myths of the disease, impart knowledge on home prevention techniques, give an update on the vaccine against COVID-19, discuss possible post-COVID requirements for students before allowing to have face-to-face classes, and discuss possible post-COVID new normal daily scenario. So let's start off with the overview of the pandemic. So as you can see, this is the world map, of course. So where's the Philippines? There, you can see that. We belong to the cases 100,001 up to 1 million. Let's see. As of November 18, 2020, 412,097 are already being reported. Aren't you proud of that number? Of course, there's nothing to be proud with that number. That's a big number, a worrisome number. For the COVID-19 statistics in the Philippines, 401,416 confirmed cases are being recorded as of November 18, 2020. In Davao City, as of November 17, there are already 4,091 cases. Oh, that's a lot of confirmed number of cases. Yes, we're number one, Davao City. Life is here. So, talking about recoveries, we have a very good sign. We have 3,491 patients who have fully recovered from COVID-19, and unfortunately, 229 deaths in Davao City. So let's check on the status of our COVID Center, which is the Southern Philippines Medical Center, as of November 17, 2020. We have an active case of 363, but with a very good recovery rate of 85.33%. Deaths, however, 5.6%. This should be what we should be worried about, the ICU beds and the ward beds. So what's the meaning of this? We have already an occupancy of 86.67%. So we are only left for 4 beds for severe cases. For the ward beds, it's 72.46% fully occupied. So that's a huge number, okay? So for now, let me just minimize my video. I will be showing you a video about COVID-19. I know you have been reading a lot about COVID-19. You have been searching it up from Google, from Yahoo, from YouTube. So let's just have a brief review of what COVID-19 is, okay? So let me just remove my thumbnail. Okay.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
So that's it as of June 2020. Okay, let's move to the facts and myths about COVID-19. Fact: vitamin and mineral supplements cannot cure COVID-19. Of course, it is not the mainstay for treatment. Your micronutrients such as vitamin D, C, and zinc are critical for a well-functioning immune system. We need it to boost our immune system because it plays a vital role in promoting health and nutritional well-being. So it is not, again, I repeat, a treatment against COVID. Fact: studies show hydroxychloroquine or chloroquine does not have a clinical benefit in treating COVID-19. Yes, it is a drug for treatment for malaria, lupus, rheumatoid arthritis, but it has been still under study for possible treatment of COVID-19. It's not yet fully evidence-based medicine. So current data shows that this drug does not reduce deaths among hospitalized COVID-19 patients, nor help people with moderate disease. Can people wear masks while exercising? You try it, you will get suffocated. People should not wear masks when exercising, as masks may reduce the ability to breathe comfortably. Of course, when you do exercise, when you go hiking, you go biking, sweat can make the mask become wet more quickly, which makes it difficult to breathe and promotes the growth of microorganisms. The important preventive measure during exercise is definitely to maintain physical distance of at least 1 meter or 6 feet from others. Can shoes spread the COVID-19 virus? The likelihood of COVID-19 being spread on shoes and infecting individuals is very low. This is just a precautionary measure, particularly in homes where infants and small children crawl or play on the floors. So consider leaving your shoes at the entrance only of your home. This will help prevent contact with dirt or any waste that could be carried on the soles of your shoes. Fact, COVID-19 is caused by a virus, not by bacteria. The virus that causes COVID-19 is in a family of viruses called Coronaviridae. As we all know, antibiotics only work for bacteria. It doesn't work against viruses. Some people who become ill with COVID-19 can also develop a bacterial infection as a complication. Only in this situation that antibiotics may be recommended by a healthcare provider. Fact, the prolonged use of medical masks when properly worn does not cause carbon dioxide intoxication nor oxygen deficiency. The prolonged use of medical masks can be uncomfortable. You try wearing it the whole day, or let's say 24 hours. Of course, it is very irritating, very uncomfortable, especially in your ears. However, it does not lead to carbon dioxide intoxication or oxygen deficiency. While wearing a medical mask, make sure it fits properly and that it is tight enough to allow you to breathe normally. Please do not reuse a disposable mask and always change it as soon as it gets damp. If it doesn't get easily damp, you have to change it every 4 hours. Fact, most people who get COVID-19 recover from it. Yes, most people who get COVID-19 have mild or moderate symptoms and can recover thanks to supportive care and immediate consultation to your attending physician. Because if you have cough, fever, and difficulty of breathing, please seek medical care early. Call your doctor or health facility by telephone first. So if you have a fever and live in an area with malaria or dengue, seek medical care immediately. Fact, drinking alcohol does not protect you against COVID-19 and can be dangerous. Yes, we often brush it off, that joke that you can use alcohol in cleaning internally and externally. Please, the harmful use of alcohol increases your risk of health problems. Fact, thermal scanners cannot detect COVID-19. Of course, it does not detect COVID-19. These are only tools that are effective in detecting people who have a fever. They cannot detect people who are infected with COVID-19. Fact, there are currently no drugs licensed for the treatment of prevention of COVID-19. Yet, while several drug trials are ongoing, there is currently no proof that hydroxychloroquine or any other drug can cure or prevent COVID-19. Adding pepper to your soup or other meals does not prevent or cure COVID-19. Hot peppers in your food, though very tasty, cannot prevent or cure COVID-19. The best way to protect yourself against the virus is to keep at least 1 meter away from others, wash your hands, eat the proper diet, take your vitamins. Of course, do not forget your exercise and sleep. Fact, COVID-19 is not transmitted through house flies. To date, there is no evidence or information to suggest that the COVID-19 virus is transmitted through house flies. The virus that causes The COVID-19 spreads primarily through droplets generated when an infected person coughs, sneezes, or speaks. You can also become infected by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. Fact, spraying or introducing bleach or another disinfectant into your body will not protect you against COVID-19. Of course, common sense will tell you that it's very, very dangerous. Do not under any circumstance spray or introduce bleach. More so, drink the disinfectant since these are poisonous, especially if ingested, and causes irritation to your skin or eyes. Fact, drinking methanol, ethanol, or bleach does not prevent or cure COVID-19 and can be extremely dangerous. Yes, methanol, ethanol, and bleach are poisons. Of course, drinking them can lead to disability and even death. 5G mobile networks do not spread COVID-19. Yeah, this is the most funny myth ever. So viruses cannot travel on radio waves or mobile networks. COVID-19 is spreading in many countries, not even having 5G mobile networks, because it is spread through respiratory droplets when an infected person coughs, sneezes, or speaks. Fact, exposing yourself to the sun or to temperatures higher than 25 degrees does not prevent nor cure COVID-19. You can catch the virus no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. Fact, being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean that you are free from the virus or any other lung disease. Yes, although the most common symptoms of COVID-19 are dry cough, tiredness, and fever, some people may develop more severe forms of the disease such as pneumonia. The best way to confirm if you have the virus is through laboratory tests, not through breathing exercise. It is not the gold standard in detecting the said virus. COVID-19 can be transmitted in areas with hot and humid climates. Yes, it can definitely be transmitted in any climate, including areas with hot and humid weather. Now, cold weather and snow cannot kill the new virus. There's no reason to believe that cold weather can kill the new coronavirus or other disease. The normal human body temperature remains around 36.5 and 37 degrees centigrade. So regardless of the external temperature weather, the most effective way to protect yourself against the virus is by frequently cleaning your hands with alcohol-based hand rub or washing them with soap and water. Washing with soap and water is still the best. Taking a hot bath does not prevent the new coronavirus disease. Yes, taking a hot bath will not prevent you from catching it. Still, I go back to the normal body temperature, 36.5 and 37. So regardless of the temperature of your bath or shower, actually it does not affect at all. So it's not a factor of getting the said condition. Are hand dryers effective in killing the coronavirus? No. Hand dryers are not effective in killing the 2019 nCoV. Again, to protect yourself against the virus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are clean, you should dry them thoroughly by using paper towels or warm air dryer. Fact, UV lamps should not be used to disinfect hands or other areas of your skin. Of course, UV radiation can cause skin irritation and damage your eyes. So please, if you have a UV lamp at your home or in any establishment or in your store or wherever, please, when you are disinfecting your area using the UV lamp, do not stay inside the room. Just leave and just go back after a few hours. Cleaning your hands with alcohol-based hand rub or washing your hands with soap and water are the most effective ways to remove the virus. Do vaccine against pneumonia protect you against the new coronavirus? No. Pneumococcal vaccine and your flu vaccine is entirely different from the coronavirus vaccine. This will just help you prevent any respiratory illness. So it's just like bringing one problem down. It does not provide protection against the the coronavirus. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No, there is no evidence for that. Regardless how often you regularly rinse your nose with saline, it does not protect you 100% from the infection. There is some limited evidence that regularly rinsing the nose with saline can help people recover more quickly only from the common cold. Can eating garlic help prevent infection with the new coronavirus? Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new nCoV. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be affected by the coronavirus. It doesn't choose any age. Older people, especially with those with pre-existing medical conditions, are more at risk, more vulnerable to becoming severely ill with the virus. WHO advised people of all age to take steps to protect themselves from the virus. Are antibiotics effective in preventing and treating the new coronavirus? No, because the antibiotic only works against bacteria. And as we all know, coronavirus is a virus. However, if you are hospitalized for the 2019 nCoV, you may receive antibiotics since bacterial infection or co-infection is definitely possible. As physicians, we don't regularly prescribe antibiotics left and right once we see patients with cough because it will just push the patient to develop antibiotic resistance, and that would be bad in the future. Are there any specific medicines to prevent or treat the new coronavirus? To date, there is still no specific medicine recommended to prevent or treat the new nCoV. Studies are still going on, and we have to wait for it. Some specific treatments, however, are under investigation and will be tested through clinical trials. As claimed, some of it are on the last phase of trial. WHO is helping to accelerate research and development efforts with a range of partners. Now let's proceed with the home prevention techniques. Stay home. For everybody, we have to stay safe. How to do that? First, stay physically active. For you students, you have to do at least 60 minutes a day of moderate to vigorous intensity physical activity. Once we say moderate intensity, it's like doing exercise that you're not capable of talking while doing that specific exercise. But if you're jogging and still able to talk, that's not that does not count as a moderate exercise. Then you should do it at least 3 days a week. Doing more than 60 minutes can give added benefits. Number 2, healthy diet. You have to eat variety of food, including fruits and vegetables. Cut back in your protein or in salt. Eat moderate amount of fats, but you have to limit salt intake. 3, healthy parenting. So I know all of you are being stressed out. All of you are being, what do you call this? You feel like being isolated, anxious. You may feel that yet yes, it's normal because it is the first time to experience such change from daily routine. But please, when you are experiencing something, if you have a problem, or you're being stressed out, you have to consult your parents or talk to your friends. It is okay not to be okay, but you have to share your problems also to your parents. Quitting tobacco. Of course, smoking is definitely bad for your health, so you have to quit it. Mental health. Yes, there are a lot of changes to our daily routines with this pandemic. So it is just appropriate for everyone to keep informed, have a routine. If you have a daily routine before, if you are not doing good with your daily routine, make a new one. And you have to meditate. Social contact is very much needed. So if you are bored, tired, or you have any problem, feel free to call your friends, relatives, or so with your parents. Take regular breaks from on-screen activities. And then keep your, like, if you are doing some mobile, or if you're playing mobile games, you have to limit it also. You have to explore more activities inside your house or even outside, do the gardening or whatever. And use your social media to promote positivity. You have to help others. And do not, at least refrain yourself from dealing with toxic people. Toxicity kills. Next, do not forget to keep hydrated. Drink plenty of water. 3 to 4 liters of water is very much healthy. Reduce sugar consumption. Okay, limit intake of sweets and sugary drinks. Lastly, of course, again and again, avoid drinking alcohol. And of course, if you're smoking, you have to at least try to quit smoking. So what's the update on the COVID-19 vaccine? As per our Health Secretary Francisco Duque, as of September 11, 2020, FDA has been working with DOST and IATF sub-technical working group on vaccine development. They have been working with companies who conduct local clinical trials in the country to ensure the vaccine's quality, safety, and efficacy. So that's the comment of Philippine Ambassador to the US, Jose Manuel Romualdez, as of November 14, 2020. Right, the good news is the vaccines will be sold to many of their allies, specifically the Philippines, at a not so expensive price. So even us doctors doesn't have any idea of the current bidding price. So yes, we have been hearing a lot about Pfizer's COVID vaccine. So Pfizer and BioNTech have said that their experimental vaccine may be 90% effective, but as of this morning, I have heard from the news that it is already 95% effective, and it's in its last stage of clinical trial. Also, Russia have presented their Sputnik V vaccine, which is 92% effective against COVID-19. Both vaccines are on the last phase of trial. So as to the price, maybe that would vary. So Secretary Carlito Calves Jr. said that scientific evaluation, selection, and guaranteed acquisition of the vaccine should be completed by the end of December. So from January to March 2021, the government targets to complete the procurement, process, production, shipment, and storage for the vaccine, as well as the implementation plan should be ready roll out. So face-to-face classes, post COVID-19 requirements. We can safely categorize the face-to-face class, or it's the lowest risk if the student and the teachers engage in virtual only classes, activities, and events, meaning low risk of harboring or getting the infection. The hybrid learning model imposes some risk if the student or some students participate in virtual learning and other students participate in in-person learning. So I believe this is the blended learning that they are promoting. The blended learning therefore imposes some risk only. So small in-person classes, activities, and events, and alternate schedules or staggered schedules are being promoted. Medium risk if most of the students participate in in-person learning, so face-to-face, and some students participate in virtual learning, parang two-third face-to-face and one-third virtual. So this imposes medium risk of harboring the infection, larger in-person classes, activities, and events, and with cohorting, alternating schedules, and staggered schedules. So with the medium risk, there's already some mixing of groups of students and teachers throughout or across school days. It is categorized as higher risk if the students and teachers engage in in-person only learning activities, meaning it's the highest risk if we push with the face-to-face. Students minimally mix between class and activities. Students and teachers share some objects. Correction, so the highest would be full face-to-face. There is a mixing of students freely in between classes and activities. Students and teachers freely share objects. Students and teachers and staff do not are not required to follow steps to protect themselves, meaning there's no proper use of face mask, social distancing, hand hygiene. This imposes definitely highest risk of contracting the virus, plus the irregular cleaning and disinfection of frequently touched areas. So here's the back to college tips to protect yourself from COVID-19. You have to remember to watch your distance. Keep that 6 feet distance from other students. You have to wash your hands regularly. It's a gold standard. Or use hand alcohol 70%. Wear a mask in public spaces and common areas. If you're wearing a cloth mask, you have to have an insert, like insert a surgical mask. And if you're wearing a surgical mask, if it's dumped within 4 hours, you have to replace it. Or not even dump, you have to replace it regularly every 4 hours. Dorm, avoid sharing items with roommates or others. But if you really do, you have to clean and disinfect before sharing or using. For those with shared bathroom, you have to avoid placing toothbrushes directly on counter surfaces. Use thoughts for personal items to limit contact with other surfaces in the bathroom. So in your classroom, you have as much as possible enroll in online classes if they fit your educational needs. But if you are in a physical classroom, you have to wipe down your desk with a disinfectant wipe if possible. Skip seats or rows to create physical distance between your classmates. Avoid placing your personal items on your desk. So you have to minimize bringing things inside the classroom. For dining halls and meals, communal eating is a no-no as much as possible. You have to avoid sharing food, drink, utensils, or other items with people. It's as much as possible. You do pick up, grab, and go options for meals if offered. So avoid buffets and self-serve stations. In the laundry room, you have to clean and disinfect surfaces that others have touched. The buttons, the tables, the baskets, etc. You have to wash your mask in warmest appropriate water setting for the fabric. So this is according to the CDC guidelines. Okay, the new normal. Again, 3 important ways to slow the spread is to wear the mask properly, covering your nose and your mouth, and it is snugly fit in your face. No spaces in between the nose, the ears, and the chin. It should be properly covered. Maintain that 6 feet distance apart. Then, of course, again and again, regularly wash your hands with soap and water. Or if not, 70% alcohol is definitely a must bring in your pocket or in your bags. So how to protect yourself when going out? Wear a mask that covers your nose and mouth. And for added protection, please wear your face shield properly. Do not wear it on your head. Use it to cover your face. Stay 6 feet apart and avoid crowds. Avoid indoor spaces, especially not well ventilated. Wash your hands often. What to do if you are sick? Stay at home. Isolate yourself. And of course, when symptoms are present, call your doctor. Or in case you're at home, if you feel like you have fever, cough, and colds, you can freely call the school clinic and they can gladly assist you in having online consult with me. So how to cope up with stress? Do not forget to take care for yourself. I know everybody is anxious, bored, depressed, or grieving. Again, it is okay not to be okay. But do not forget that you have friends and families that loves you or who cares for you. So do not forget that. You have to have a support system. Unwind. I don't mean that you go out with your friends, party, go to the mall, go shopping. No. Unwind. Do any other thing aside from studying. So read other books other than your school books. You can opt for gardening or doing handcrafts or painting or whatever. Clean your room, clean your car, or help with the household chores. Unwind, rest. Find new ways to connect with family and friends. So, of course, all of you have gadgets. You can do FaceTime or what do you call that? WhatsApp or Facebook Messenger or Viber or even Zoom. Okay, do not forget that you have friends and family that loves and is caring for you. Eat healthy foods and get enough rest. So do not load yourself with junk foods or carbonated drinks. Do not practice or do not try to perfect being a couch potato. Eat healthy foods and get enough rest, and most of all, do some exercise. Stand up, stretch, and exercise. And most of all, relax, breathe, sleep, socialize, and exercise. Thank you for listening.